We are really risking that cardiovascular diseases will increase, and there's a projection that by 2050 there would be 90% increase and more lives lost.
Cardiovascular diseases are the foremost cause of death in the EU, responsible for nearly 1 in 3 fatalities, over 1.8 million deaths each year. With approximately 62 million individuals affected, the impact is staggering. While mortality rates have improved over the last 50 years, cardiovascular diseases continue to inflict significant disability, premature death and economic strain, costing the EU an estimated €282 billion annually. Marianne Takki, a senior official at the European Commission and a trained medical doctor, plays a pivotal role in addressing this critical health challenge through the EU Safe Hearts Plan. Launched on December 16, 2025, this groundbreaking initiative represents the first coordinated EU strategy to combat cardiovascular diseases. It tackles urgent challenges across the region, specifically focusing on the unique needs of vulnerable groups such as children, young people, and women. In this podcast, we have the opportunity to explore the EU Safe Hearts Plan with Marianne Takki, with a particular emphasis on cardiomyopathies, a group of heart muscle diseases that hinder the heart's ability to pump blood effectively. These conditions can lead to a thickening or stiffening of the heart muscle, significantly raising the risk of heart failure or sudden cardiac death. Alarmingly, many individuals remain unaware of their condition, facing the very real risk of sudden death. The EU raises awareness and takes action to protect lives today. The EU Safe Hearts Plan represents a significant breakthrough in tackling cardiovascular challenges head-on.
It's the first ever cardiovascular health plan at the EU level, and it's because it takes a comprehensive approach. So it's not only looking at one disease, it's looking at the whole pathway of how cardiovascular diseases can be prevented, how we can screen for those diseases so that we find the people who are at risk of developing a cardiovascular disease, and how then in the end we can support member states in treatment, rehabilitation, and making sure that every patient gets the help they need. What is also new and groundbreaking with this Safe Hearts Plan is that we tap into new solutions. And these are, of course, from artificial intelligence, from personalized technologies and digital solutions. And we also bring in all the investments and capacities that we have across Europe, be it in research or innovation, but also in tackling health inequalities. And by doing this plan, we try to cover all the key areas where member states have challenges. And we have 10 major, we call them flagship initiatives, but basically they are big actions where we think that the member states can work together, for example, on tackling inequalities and making sure that we reach everybody. If we wouldn't do this, we are really risking that cardiovascular diseases will increase. And there's a projection that by 2050 there would be 90% increase and more lives lost. That's why we believe that it's a turning point for Europe. What with the AI we want to do is we want to make sure that when we collect data, for example, under the European Health Data Space, this is one of the biggest initiatives we have in the area of health in Europe. We want to make sure that the data collected will be for the benefit of cardiovascular research. It will be for the benefit of patients. So we pool resources in a better way. In terms of artificial intelligence or digital otherwise, of course, we have research projects where we are looking at, for example, how to use artificial intelligence in finding inherited conditions better and so on. So it's not only one thing, it's across the board. It's a horizontal priority. The whole cardiovascular disease discussion actually started with a political level at the time. Member states, through the council conclusions, this is like a document where member states' health ministers agree that something is very important. And during the Hungarian presidency, ministers wanted to have more focus on cardiovascular diseases. And this is one of the reasons why we have the cardiovascular health plan, the Safe Hearts plan. And of course, our President von der Leyen, and our Commissioner Varhelyi, they have in their mission for this commission to boost prevention, to step up efforts on cardiovascular health. So the political momentum is really now, and we're very happy to have the plan because it's a strategic framework and we can now push work forward. Even though cardiomyopathies are not usually part of formal screening programs, health checks can still really play an important role in the entry into the treatment pathway. What we want to do, and we have clear targets in the Safe Hearts plan, we want to have people measure their blood pressure at least once a year by health professionals. And the target is to have around 75% of people between 25 to 64-year-olds and at least 90% of people aged 65 and older. So this is super ambitious target, but too many people do not know their blood pressure. And blood pressure is one of the risk factors for structural heart diseases. So this is why it's an important area. We are working currently on a proposal for a council recommendation on health checks. When this podcast comes out, we already will have had results of a call for evidence where we collect inputs from stakeholders, health professionals, citizens, everyone on what we should be doing in this area, and we will be analyzing the feedback. So the aim is during this year still to come up with this proposal for health checks, and then it's up to the member states, of course, to decide how they would implement these things. And in the area of treatment, so once we find those people who are at risk of having a cardiovascular disease or at risk of developing one, of course, we need to have also solutions on how they can be treated. And for that, we are working towards a council recommendation on treatments. And the idea there is to make sure that treatment pathways are starting from prevention to treatment and rehabilitation. And this we plan to develop next year. And then finally, maybe just to mention that we are also aiming at setting up a European network of cardiovascular health centers so that the expertise can be better pooled, and we can also facilitate the uptake of diagnosis and treatments and care for the people. Maybe the final thing just to mention in early detection and screening is, of course, we have already invested a lot of research budget on cardiovascular and this kind of research. Already 2.3 billion euros from the EU research programs has been spent on this. So maybe just to highlight those issues on early detection and screening. That's probably the most crucial point of health policy making in today's Europe. We are co-creating many of these actions with the member states, with the citizens and stakeholders. When we created the Safe Hearts plan, we consulted broadly a stakeholder community, so the public health organizations, NGOs, citizen groups, and so on. We had webinars, we had a call for evidence. And what I really want to also emphasize is that young people are an important part of our consultations. And we had separate discussions with young cardiovascular disease patients, because if we want to make cardiovascular health plan successful, and we need to look at also very long time span, we need to start with very young age. The earlier the better, and that's why the young people and people with lived experience are essential, because they have the experience, they have the knowledge, and they have also the contacts with the other patients, and we need to rely on their views. And I hope that with the Safe Hearts plan, also now when I go to different meetings like this and also to this podcast, what I really want to make sure is that people know that they can reach out to us, they can reach out to the organizations, and that we are working on this together. We don't have a huge budget to do this work, but what we have is a strong will and a lot of commitment from the stakeholders. And this we ensured because we brought them at the start of the development of this plan, and I think that's crucial in everything we do in health policy making. The responsibility for organizing, financing, and making sure that the health systems work is with the member states. The member states, they have the decision-making power and responsibility of organizing this kind of early detection or genetic screening processes. What the Safe Heart Plan does, it provides a strategic framework, and the early detection and screening program that we are trying to set up now through the Council recommendation, it's a recommendation to the member states. So then it's up to the member states to decide how they actually organize it. Now, genetic screening, it can be very complex because it can cover so many different disease areas. What we try to do with the Safe Hearts Plan is to make sure that we cover as many sort of disease areas as possible. And the key tool and the most instrumental tool for that is prevention, because cardiomyopathies, like many other cardiovascular diseases, they share common risk factors: nutrition, hypertension, cholesterol levels, diabetes. There are a lot of different risk factors that we need to find and tackle so that we can prevent diseases becoming worse, or we can find them early enough. So it's more a framework and a basis for member states and countries to take things forward. But for the time being, never before we have had this kind of discussions between political level, between hospitals, health professionals. So I think the momentum really to push things forward is now. Addressing inequalities between countries and population groups is a cross-cutting theme in the Safe Hearts Plan. And access to care can differ between population groups. For example, women are disadvantaged in cardiovascular care. There's often underdiagnosis, undertreatment, and they're also underrepresented in clinical trials. And this can have an impact on delayed diagnosis and treatment. This is probably partly because of the different symptoms women have. For example, for heart attacks compared to men, it's all about knowledge, it's about research. And this gap we try to fill through new research. We have 2 million euros we are putting into specific research, just looking at the gender differences. We also have a separate action. It's called Creating a Dashboard on Health Inequalities in Cardiovascular Health. We kind of stole the idea of Cancer Inequalities Registry, where there is information about problems or challenges in different areas of care. And we want to do the same thing on cardiovascular health. We want to find where are the policy gaps in helping everyone to get the care and treatment they need, to improve access, to steer investments in cardiovascular health, and also to find where policy gaps could be. And this inequalities dashboard we are developing together with our colleagues from Joint Research Centre, which is part of the Commission. It's one of the Commission departments. And then finally, in terms of equitable access to treatment, care, prevention, it's of course important that the patients and health professionals know what kind of symptoms they have or what kind of risks there could be. And for that, we are preparing an awareness campaign, which will come out in the fall. It's called Know Your Numbers, so that people know what their blood pressure is, what their cholesterol levels are, if they have too high sugar in the blood. So we have different actions that we hope will be helping at the EU level to different people in this. In underrepresented populations, or like what we say at the EU jargon, it's vulnerable populations, they have a lot of different risks compared to the general population. We know that socioeconomic factors play an important role in prevention, but also in getting the access and care you need. I wouldn't single out one specific disease area like cardiomyopathies. It's across the board, not only on cardiovascular health, but it's also on all kinds of non-communicable diseases. And this is why prevention at the population level is so essential, because not only can we address cardiovascular diseases, but also cancer, obesity, diabetes, and so on. We need to make sure that we have the whole pathway of prevention, early detection, and screening, and then to have the right treatment and also more personalized approaches, which are enabled in today's Europe through digital, artificial intelligence, and so on. First of all, in this plan, communication is a cross-cutting issue. And what it means in practice is that whenever we have a major initiative, we go out to the stakeholder community. I have been in several meetings, for example, this week with the European Committee of the Regions. I've been with the healthcare industry yesterday. I have been with health professionals. We also have major joint actions, which are basically projects between member states, where countries discuss how they can better improve cardiovascular health through different actions. And we communicate together with all those actors I mentioned, including also patient groups and so on the action, so that we reach also at the grassroots level those who are working with the patients. The Know Your Numbers campaign, which I mentioned earlier, we will launch in the fall, and it aims to raise awareness of the need of the health checks and the key risk factors. And this will support the proposal we are going to have on the Council recommendation on health checks. The campaign, Know Your Numbers pilot campaign, will target men and women between 25 and 64. This group was selected because people at this age group are often unaware of their own risk factors. They might have silent conditions like high blood pressure. And we want to really encourage everyone to know what their numbers are on blood pressure, cholesterol, sugar levels, to be able to support early detection and encourage lifestyle changes. I think there are a lot of different useful and good best practices from different regions of the EU. But what I could mention, it's a little bit outside of cardiovascular health, but it's on mental health, where we have a major project. It's called EU Promise, where we have set up a multi-million euro program for people who are dealing with mental health, who want to make sure that mental health well-being is taken into consideration. We have created a program for them for training and exchange. So between European countries, for example, teachers who are working with kids who might have challenges in the area of mental health can go to another country to learn about best practices. Multidisciplinary or comprehensive approach that we need in health, not only on mental health, but on cardiovascular health and in many other areas, is essential, because not one health professional alone can help patients who have maybe multimorbidities. Cardiovascular health is closely linked with diabetes, kidney diseases. There might be other challenges. Mental health is important. So it's usually a group of professionals who closely work together with the patient. And this is really important also, because the patient is the one who then takes care of her own or his own treatment and medication, and also the lifestyle changes. And in the area of cardiovascular health, we are really developing this right now. There is a big joint action, Cardi, which is led by Italy, and they are developing also different kinds of solutions. So we have a lot of material and possibilities and actions at the EU level, and different countries are, of course, choosing the ones that fit best to their national settings. Well, as head of unit for Safe Hearts plan. I'm of course very happy to see that together with the different Commission services, member states and stakeholders, we now have a strategic framework for prevention, early detection, and for treatment. To get all the way where I, as a medical doctor and as a Commission official, would like to see us, it will be hard work. It will take many years, but I see the commitment right now at the EU level, and I feel positive that we will be able to reach milestones. Cardiovascular diseases are the number one killer in Europe. We have tools, we have the political will, we have the steer, where is the direction we can go. And I think now it's the momentum really turn this into concrete actions. And I would love to say that in 5 years we are there, but in public health, everything takes a lot of time. But once you do the shift, then you're already going into the right direction. And I hope this helps us to do the shift. There's one thing I would have wanted to say. I kind of mentioned it, but when I was a young doctor, I was working actually in healthcare centers, and I was super young. I think I was still a student. I was alone for a whole weekend, and there were several ambulances in the row, and every one of those patients had something to do with heart problems. So I'm extremely proud that I'm now at this level, being able to do maybe a difference also for those young doctors who are in, somewhere in Finland or anywhere in Europe, struggling with the situations.
You've been listening to Combating Cardiomyopathies and Other Cardiovascular Diseases. Dr. Marianne Takki explained about the EU Safe Hearts Plan, Europe's major comprehensive strategy to tackle cardiovascular diseases, Europe's biggest killer, claiming 1.7 million lives annually. The Safe Hearts Plan represents the first ever EU-wide approach to this issue and is a key pillar of European health policy. Thanks for listening.